Good morning, friends. Today we are going to talk about the cranial nerve number 7, that is facial nerve. And here we are moving to concentrate on the main functions of its and the course, how it exists through the skull to its terminal branches in the face, then anatomical landmarks used to visualize the branches, and some clinical presentations. So as we know, this particular cranial nerve is a mixed type of nerve, so it has both motor efferent and sensory efferents. So spatial visceral efferents part, it works for the muscles of facial expressions, which conveys the emotions, and posterior valley of digastric, styloid, and stapedius muscles. These are mainly conducting their motor visceral efferents. Then general visceral efferents, they will be parasympathetics, lacrimal, sublingual, submandibular glands, which produces tears and saliva. So this will be its motor function. Then talking about its sensory function, there is special visceral efferents, which is basically for the anterior two-third of tongue, which carries the taste. And also should be noted that cranial 7 also carries general somatic efferents from skin behind the ear part also. Behind the ear part, that is behind the lobule part, also same particular nerve is going to take the sensory innervations. Now, how it exists? So, cranial 7 nerve exists through the cranial cavity through two structures. First is internal acoustic meatus, and next is stylomastoid foramen. So, internal acoustic meatus, you can see this part, which is green, this particular part. This is internal acoustic meatus. And styloid foramen, you can see here, this part, blue part, that is styloid foramen, stylomastoid foramen. So from these two parts, the cranial cavity, cranial nerve 7 exists from the cranial cavity. Now, what are the anatomical landmarks? So, anatomical landmark is very simple to identify. That is parotid gland for the main motor branches. So, you can see facial nerve. It will branch like this, and parotid gland. This is the parotid gland just on the side of your ears, external ear. You can see this is parotid gland. But one thing has to be very much confirmed that there is no functional relationship between parotid gland and cranial nerve 7. The facial nerve does not have any sensory or motor innervation to parotid gland. It is just an landmark. Cranial nerve 7, facial nerve doesn't give any supply or take any innervation from that particular gland. So you can see again, this is parotid gland and how the nerves are related to, the branches are related to this particular thing. So you can see each of the branches coming behind or underneath from the parotid gland itself. So basically, we have learned that there are 5 branches which are coming from the secondary pharyngeal arch. So 5 motor branches. So arising within the facial canal is the nerve to stapedius in the middle ear. These are extra, other than 5. 3 branches are given off between the stylomastoid foramen and parotid gland. What are they? Posterior auricular nerve, nerve to posterior valley of digastric muscle, and nerve to styloid muscle. Let us see now what are the 5 main. First is temporal. You can see which is going towards the temporal side. It is going to innervate the frontalis, orbicularis, and corrugator supercilii. All these are present in this part, temporalis part, and some part of the frontal also. Then you can see zygomatic. This innervates the orbicularis oculi muscle. Then buccal, or innervates the cheek muscle, like innervates the orbicularis oris, buccinator, and zygomaticus muscles. Then marginal mandibular, it is going to the lower side. It will innervate to the mentalis, and then the cervical, which goes towards the platysma. These are the 5 main motor branches. Again, I will show you additional branches. They arise from facial canal in the nerve to stapedius in middle ear. The 3 branches are there: posterior auricular nerve, nerve to posterior valley of digastric, and nerve to styloid muscles. Now let's see the motor branches. So a hand on face method can be useful in memorizing the 5 motor branches. You can see like this. You can put your hand like this, and you will get thumb will be go to the temporal side. Then next finger will go into the zygomatic, the buccal, mandibular, and the little finger will go to the cervical. So by this, you can simply learn the motor branches. Next, coming to the sensory part, the branch of facial nerve carries the taste from the anterior two-thirds of tongue is called as chorda tympani. It extends to the tongue via lingual nerve, which is the branch of trigeminal mandibular third part. So you can see this is facial nerve, and from here the mandibular nerve is also coming, and they both combine to form, you can see now, chorda tympani. This is chorda tympani. So some part of it is also hitchhiking on this particular part. So it will take the taste from the anterior two-third. Now cranial third, mandibular, there are more branches you can see from here. Auriculotemporal nerve, inferior alveolar nerve, and lingual nerve. So let us see all these things again so that we can get more clear view. So anterior two-third is brought by chorda tympani, which is the branch of 7. So you can see anterior two-third. But it extends to tongue via means through lingual nerve also. So if you want to see the lingual nerve directly, you can see this lingual nerve. This is lingual nerve. So via lingual nerve only, it is going to give you the supply. And this was the chorda tympani also. So both have some common pathway you can see from this diagram. Other than this, there is auriculotemporal and inferior alveolar also, which is the branches from the third part of trigeminal. Now, anterior two-third anterior, you can see this part. It has hooks onto the cranial nerve number V3. We have seen previously lingual nerve in the infratemporal fossa. So facial nerve, chorda tympani, and lingual nerve V3. So like this, the taste fibers are going to be seen. You can see these are the taste fibers. And taste from soft palate, how it is going to be? So it is again by the C7 only hops into the cranial nerve, second part of trigeminal nerve in pterygopalatine fossa. So let us remove all these things first. We'll leave out the taste fibers. So you can see pterygopalatine ganglion first of all, then cranial nerve number P2, that is maxillary part, and then you can see the palatal nerve. So these will take the senses from the soft palate, and first part we have talked about the anterior two-third. Now talking to the parasympathetic fibers, that is hitchhiking, which I have told you. The chorda tympani also carries the parasympathetic fibers to all the glands below to the oral fissure. It carries preganglionic parasympathetic fibers to submandibular ganglion, which stimulates salivation from both submandibular as well as sublingual glands. This is chorda tympani via lingual nerve, which is hitchhiking on this particular, and it is also giving supply to the, or taking supply from the parasympathetic supply from the both submandibular, as you can see here, and this is sublingual via submandibular ganglion. You can see the parasympathetic. This is how it is going to work. It stimulates the production of saliva from submandibular and sublingual gland, synapse at the submandibular ganglion. This is submandibular ganglion, but it is going to get synapsed, and via this, it is going to give the supply to the submandibular gland as well as the sublingual gland, making them to produce the saliva. So this nerve is also responsible for the parasympathetic innervation of lacrimal glands in the oral and nasal cavity, and related areas of skin. Fibers travels into the pterygopalatine fossa, synapse with pterygopalatine ganglion. So you can see first to the lacrimal gland, how this is going to happen. So this is pterygopalatine ganglion. From here only everything will happen actually. So foreganglionic parasympathetic fiber exists by inferior orbital fissure and joined to the ophthalmic part of the trigeminal nerve, reaches ultimately to the lacrimal gland. As we have seen this, you can see again like this. Talking to the nasal gland, you can see the nasal glands. Postganglionic parasympathetic fiber exists by sphenopalatine foramen and joins maxillary part of the trigeminal nerve into the nasal cavity. This is again through this only that it is going to give the supply to the nasal gland. Then you can also see the oral part, oral glands. You can see from here only the oral glands. So it exists to the palatine canal. This is palatine canal and joins the fiber of V2, that is maxillary fibers, into the oral cavity. So this is why everything is happening through the pterygopalatine ganglion only. So This seventh nerve is also giving parasympathetic fibers to the these particular type glands via again hitchhiking on the cranial nerve number trigeminal part 1 and 2. Previously, we have seen hitchhiking on the third part. You can see here, this is how it is going to give the supply. Facial nerve is coming now to pterygoid canal, going to the lacrimal, going via through the pterygopalatine ganglion, through the nasal also, through the oral also. Now let's see some clinical point, as you might be knowing very much about this facial nerve paralysis. So an infection with herpes simplex virus especially may cause inflammation of facial nerve at the level of internal acoustic meatus. We have seen there were two openings through cranial nerve. One was this also, causing lower motor neuron damage to nerve 7. A lower motor neuron damage is also called as Bell's palsy. So you can see here, this is lower face, upper face part. This will be basically disturbed, so lower face will be gone. We'll have some injuries. So what will be the consequences? The consequences you can see the loss of innervation to the both upper and lower face. Lower motor neuron lesion will occur. The peripheral nerve carries fibers to both upper and lower faces lesion. This results in the paralysis of entire side of the face. So one whole side of the face will be paralyzed. So the clinical presentations will be like the upper and lower facial palsy, twitching or weakness, drooping of eyelids and mouth, impaired taste, inability to close the eye on the affected side, inability to smile on the affected side. You can see on the affected side, they can't smile, they can't close the eyes, and drooping of eyelids is a common presentation. So what we can summarize here, that it's a mixed nerve. Motor fiber innervates the muscles of facial expression. Sensory fibers carries the anterior two-thirds of tongue via chorda tympani. Facial nerve also carries the parasympathetic fibers to lacrimal, sublingual, and submandibular glands. The facial nerve exists through the skull through the internal acoustic meatus and stylomastoid foramen, giving 5 main motor branches: temporal, zygomatic, buccal, marginal, mandibular, and cervical. You can keep your hand like this and it will be very easy to remember. Damage to facial nerve results in the Bell's palsy, which clinically presents as the paralysis or weakness of facial expressions. So this was all about today's topic. Thank you.